Hi, I'm Dr. Barry Gillespie. I practice in the King of Prussia Medical Center in King of Prussia, Pennsylvania, United States of America. And today I'm going to discuss infant conditions. The craniosacral fascial system is a system I discovered about 20 years ago, and it involves two components. It involves the craniosacral aspect. The brain needs to slowly expand and slowly contract. And this expansion and contraction is called the breathing brain. The brain has to breathe. And what we do is we'll time the expansion and contraction in seconds. And usually for infants, we like to see the infant loose enough where the brain is expanding at least 50 seconds and contracting 50 seconds. So the brain cycle would be 100 seconds. And as we found, as the baby got better, the cycle might go to 150 or 200 seconds, where the brain is very slow, it's very relaxed, it's very calm, and it's expanding 100 seconds, and it's just really relaxed, and it slows down, and then it contracts about 100 seconds. So we found out that when the babies got up to close to 200 seconds, that was a pretty good marker where they were pretty happy, and a lot of their conditions went away. The sacral aspect is the tailbone. The tailbone is right below the lumbar, the spinal segment. It's that big bone that gently flexes and extends. So the sacrum continually has this flexion and extension as the brain is expanding and contracting. So I have this little toy that I show people, I show the moms, and usually children come in and babies come in and they're very tight. And I'll say to the mother, this is your brain, your child's brain. And after the first visit, the brain cycle might open up to where the brain's expanding 30 seconds and it's slowly expanding, and it slows down and it contracts for about 30 seconds. And this is what we call the brain cycle of 60 seconds. Ideally, the child, we would like to have the brain cycle maybe 150 or possibly 200 seconds, where the brain is slowly expanding 100 seconds, and it's opening up really wide, and it's very relaxed and very calm, and then it's contracting another 100 seconds. So this whole brain cycle would be 200 seconds. And the sacrum would move correspondingly with it in sync, where it'd be slowly moving in flexion and extension. And this is the craniosacral aspect of this particular system. The other part of the system is the fascial web. The fascial web is the connective tissue web that's from head to toe, finger to finger. The connective tissue surrounds every muscle cell. It goes into every organ. It goes into every bone. It goes into the eyes, into the teeth. It surrounds the blood vessels. It surrounds the nerves, where it can cause pain if there's a lot of pressure there, so people have pain in their head or their neck or whatever. The fascia can get very tight. It can pull about 2,000 pounds per square inch. So there's a lot of pressure in your body, and you just might feel that you're tight, or your child may be tight. And this tightness can cause some issues. And what we found is that if this craniosacral fascial system is tight, people don't function that well. And basically what therapy is to gradually, over a series of visits, to free up this system to help the body loosen this craniosacral fascial system because you're too tight. Basically, we see tight people. They have a lot of problems that nobody else can really put their finger on. And because their body starts to loosen up, their body can heal better, and a lot of the issues that they're dealing with can correct. Birth trauma. Birth trauma can really affect this craniosacral fascial system. It can do in three different components. The first would be during delivery. If it's a delivery with forceps, where forceps are clasped on the head and there's a lot of twisting, pressure, rotating, or if there's vacuum suction, where the vacuum suction is on the head, that can create a lot of strain in the head. A difficult delivery could involve shoulder dystocia, where your shoulder is caught right below your mom's pubic bone and it's stuck in there and can't get out. So the delivery can have a great effect on the craniosacral fascial system. Also, a difficult long labor can have a tremendous effect where you're in position. You may be in position for hours, 16, 18, 20, 30, 40. I mean, in our research with newborns, the longest labor we dealt with was an infant who had 71 hours of labor, and there was a lot of pressure in his body. The third part of birth trauma could possibly be in utero. And originally when we did our research, we thought in utero was a nice place to be. But unfortunately, if there are fibroid tumors, if there is a lot of pressure in there, if you're in there with another baby, if they're twins, multiple birth, and there are many other situations where the pressure can create craniosacral fascial strain in you, the fetus. Birth trauma can cause many conditions. It could cause a nursing issue where there's difficulty latching on, difficulty sucking, and difficulty swallowing. It can cause colic, and it can cause reflux, indigestion, constipation. It can also cause strabismus, stridor, pyloric stenosis, clubfoot, and torticollis. Those are our major conditions. The baby brain scourge was started in 2006. I became interested in working on infants, and I started doing some research around it, and I looked at the APGAR score that's given to every baby born in every hospital in the world. And that's a score to determine how well the vital functions are in that baby. When the baby's first born, is the heart beating well, the lungs breathing, it gets you into the world alive. And I looked at that score and I said, it really doesn't say too much, doesn't really address any issues of the brain, how well the brain is working, and it doesn't tell us the possible quality of life issues that it may have down the road. So I thought about, well, maybe we should have a baby brain score, and I came up with a very similar components that APGAR found with the APGAR score. And we have 4 different components where we're looking at the brain motion, how well is the brain breathing, how well is the sacrum moving, how symmetrical is the head, and if the umbilical cord was an issue, was it wrapped around the body. And we assigned each of those components a 2 if everything was great, a 1 if there was some problem there, and 0 if there was a huge red flag. And we created a score, the baby brain score, very similar to the APGAR score. We researched this for 2 years. There were a number of people, Kristen Myers, Michael Myers, Christine Holtfelder, and a few other people. We investigated the baby brain score. We field tested it. We spent about 2 years on it, getting it perfected exactly the way we want it. And then we went to Mexico to teach a number of medical professionals there, and we tested the baby brain score internationally in a different culture, a different language, and it worked beautifully. So we're very happy with it. What it is, it's just a tool to tell us right at the birth, right when you're a few minutes old, if there is a problem, if a possible problem with how the brain is functioning. This research was done during the time we were doing the baby brain score. We were seeing dozens of babies, and we started doing testing the score, but the score doesn't really give you any treatment. It doesn't get you any better. So we continued with treatment with that, and we found out that the babies started getting better with their colic and their reflux, and they could breastfeed better, and a lot of good things were happening. So what we did was we set aside 1 day a week where we worked with infants, usually less than 6 weeks. And we worked on about 100 different infants. And we found that everything was opening up. The babies were getting better. The mothers were being pleased. We're very pleased with the therapy. So Kristen Myers, Michael Myers, and myself decided to do a research project. And the bottom line is we saw 332 babies over a number of years. And they did very well with the conditions that I mentioned. We found out those conditions are due to tightness. The craniosacral fascial system is tight. And when we started to loosen this system up, the baby's bodies work better. They were very fussy to begin with. They were very cranky. They were crying. And at the end, we found out that the babies were pretty happy. And the mothers would come in and say, I have a happy baby. The colic is gone, the reflux is gone, my baby's very calm, my baby's very content. So I was working with Michael Myers one day, and we said, well, we are the happy baby people. That's who we are. We're in the happy baby business. And mothers come to us with fussy babies, colic, reflux, and this, that, and the other thing, and indigestion and constipation, and they leave and they're pretty happy. Well, they're basically tight, and we help loosen them up. And that's what we do. We're not involved with viruses or bacteria or anything of that nature. We see tight babies, and those are the babies that seem to be unhappy. What we do is we will hold the baby. If I'm working on a baby, or if two people are working on a baby, we'll hold the baby, and the baby usually knows what it wants to do, and it may stretch a little bit, and they start stretching, and we just follow the stretch, and the stretch starts to go, and we just we're just following the body, and we're supporting the body, but we're not fixing the body, we're not manipulating the body, we're not adjusting the body, we're not trying to cure a baby of anything. We're just realizing that we're just trying to loosen the baby up. We're trying to help the baby free up its tightness. Had 9 months of a difficult situation, and it's come out, and it's a little bit tight. And we feel that if you're tight in your throat, you may have reflux. If you're tight in your eye, you may have strabismus. If you're tight in your hips, you may have low back problems, tight pain. If you're tight in your abdominal cavity, you may have colic. If you're tight in your GI tract up here, from diaphragm up and to the throat, you may have reflux. So basically, in our research, we believe that these conditions are diseases of tightness. And by loosening babies up, they gradually, over a series of visits, go away. We feel it is. We've done research with over 800 babies in Mexico, America, and Canada. I have students in South America and Europe and Africa, and they're seeing the same thing, the same results. And it seems like it's universal. If there's trauma or strain somewhere in the birthing situation, the baby can be fussy no matter where they are on the planet. So we believe that this type of therapy can be effective for babies everywhere.